So let's discuss about lactulose. This is a very important drug. We use it for constipation as well as we use it for hepatic encephalopathy. So I just wanted to tell you that there is something called as laxative as well as purgative. In high dose, a laxative basically acts as a purgative. Laxative is of milder action and purgative is a powerful action. Laxative leads to only evacuation of formed stool, whereas purgative both formed as well as non-formed stool. Now discuss about the mechanism of action in how lactulose actually acts in constipation. So this is your GI tract. Actually, lactulose is a disaccharide. This is a combination of fructose as well as lactose. This is basically lactulose is basically a disaccharide which is non-digested as well as non-absorbable in small gut. So from stomach to small intestine, lactulose is not digested nor absorbed. So in undigested, unabsorbed condition, this is being delivered into the colon, that is the large intestine, where you can see we have some naughty bacteria. They are supposed to act upon this lactulose, and eventually this lactulose is been broken down to monosaccharides, that is fructose and lactose, as well as few acids like lactic acid, acetic acid, as well as formic acids. So these monosaccharides, lactic acids, formic acids and acetic acids, these are very hyperosmolar substances. Hyperosmolar, that means they drags water from the blood circulation, and eventually when they are dragging the water, automatically the bulk of the stool getting increased, and eventually there is relief, that is improvement in constipation. There is proper evacuation. That is how lactulose basically acts as an medication for constipation. Now in case of children, 1 to 2 ml per kg per day. In case of adult, 30 to 45 ml per dose, which is basically 4 times given in a day. Now let's talk about the mechanism of action in hepatic encephalopathy. So once again, this is your gut. So before we start to understand the mechanism of action, we must understand how hepatic encephalopathy actually happens, the pathogenesis of it. So initially when we take the proteins, it is broken down to amino acids. In the amino acid structures, we have two carbon atoms as well as NH2. By the process of deamination, this NH2 molecule is being broken and we get ammonia, that is NH3. This ammonia should be handled within the liver via urea cycle, and urea should be produced. Urea basically contains two ammonia molecule, and this urea can easily be flushed into urine, that is, it is being handled in the kidney. But what happens in hepatic encephalopathy, there is too much of ammonia. As the liver is not functioning, there is no urea cycle, there is too much of ammonia within the blood circulation. This ammonia straight away enters into your central nervous system. But you should be knowing that within the central nervous system there is no urea cycle such that. So this ammonia is very toxic, especially the toxic form is when it combines with the glutamate. This is basically an astrocyte. Within the astrocyte there is glutamine synthase, and this basically converts glutamate plus ammonia into glutamine. This glutamine is very much toxic to these astrocytes or type 2 Alzheimer's cells. So automatically the glutamate concentration reduces. Automatically glutamate concentration reduces within the cell, but we don't know the mechanism. Within the CSF there is increased amount of glutamate, and this increased amount of glutamate basically acts over the NMDA receptors, and it basically acts on the astrocytes, which basically irritates an astrocytes, and eventually this oxidative stress response comes into play, and which is called as encephalopathy. So due to hepatic dysfunction there is encephalopathy, therefore this is called as hepatic encephalopathy, and all are due to dysfunction of the liver. Now let's talk about the mechanism of action of lactulose and how lactulose basically helps in hepatic encephalopathy. Once again, the lactulose is totally undigested and unabsorbed within the small intestine as well as in the stomach. It goes into colon where there are some naughty bacteria, as you know. They basically converts it into monosaccharides, that is fructose as well as lactose, and also lactic acid, formic acid and acetic acids. These are volatile acids, and those bacteria, those naughty bacteria which basically produce the NH3 plus, this NH3 plus combines with the H plus and eventually forms NH4 plus molecule from ammonia to ammonium ion. As the ammonium ions are charged molecule, they are positively charged molecule, they cannot be absorbed, they cannot cross the biological membrane, they eventually flushed with the stool outside. As well as this acidic environment basically inhibits those bacteria which produces NH3. So the NH3 is being excreted as the NH3 is being converted to NH4 plus via those acids, as well as those acidic environments inhibit those NH3 producing bacteria. So NH3, number one, the NH3 is being reduced via flushing into the stool, and it cannot be absorbed.